Anthem Inc. denial rates for addiction treatment run at twice the industry average, and your billing department feels it on every claim. Anthem constantly denies all types of health coverage at twice the rate of the industry average. For a behavioral health center, that is real revenues stuck in dispute. What Anthem Inc.'s level of care denial rates mean for your addiction treatment center's billing operations, and how to fight back. We cover who Anthem is, how their denial rates compare, why the denials are so high, and what your center can do about them. Anthem Inc. is the largest for-profit federation member of the Blue Cross Blue Shield Association, with over 45 million members in the United States. Anthem is the largest for-profit federation member of the Blue Cross Blue Shield Association, with over 45.1 million members and counting. Because Anthem owns such a large share of the insurance marketplace, you will see them in your billing department again and again. In 2019, Anthem's denial rate was 35%, against an industry average hovering around 17%. Every denial is revenue your team has to chase. In 2019, Anthem's denial rate was 35%. The average rate of denials in the industry hovers around 17%. Anthem has been repeatedly fined millions of dollars for reneging on their financial responsibility to patients and providers, with denials figuring largely in that pattern. A CBS investigation in 2014 uncovered a claim denial rate for mental and behavioral health care exceeding 90% at Anthem, the care your center delivers most at risk. A CBS investigation in 2014 uncovered a claim denial rate for mental and behavioral health care exceeding 90% at Anthem. A New Hampshire study found Anthem Blue Cross and Blue Shield, with Cigna and Harvard Pilgrim, deny opioid treatment at rates between 9.5 and 28.3%. Anthem uses several different mechanisms to deny addiction treatment claims. Experts point to three things in particular. USA Today reported that many experts blame three factors for the high denial rates at Anthem. Let us walk through them. Reason 1. New documentation requirements. Experts cite new documentation requirements as one driver of Anthem's high denial rates. Each claim has to clear a higher paperwork bar. Reason 2. Overly conservative prior authorization rules. Overly conservative prior authorization rules are a second factor. Experts blame for the volume of denials Anthem issues. Reason 3. Anthem insists medical professionals, not support staff, defend claims by phone. Anthem's insistence that medical professionals, rather than support staff, spend time on the phone defending claims to Anthem representatives is a third factor experts cite. For behavioral health providers and addiction treatment centers, the problems are most often centered on level of care concerns. Anthem frequently denies physician-requested inpatient care and offers a lower level of care, like outpatient, instead. The transparency and coverage public use files break Anthem's denials into categories, and the largest one is telling. In the transparency and coverage public use files, about 25% of Anthem's denials can be traced to plan exclusions. Another 9% are based on the fact that a required referral was not secured prior to the service. The majority of Anthem's denials are listed under Other, and investigators find that outside medical necessity, the most common cause is quibbles with the level of care requested. The most common denial cause outside medical necessity is the level of care requested, so the fight is won on documentation and appeals. The denials most often turn on level of care and medical necessity, so the documentation that supports the level of care billed is what protects the claim. Level of care denials can be appealed rather than written off. That is where a behavioral health billing specialist makes the difference. Behave Health's Revenue Cycle Management Service gives hands-on attention to every component of your addiction treatment billing, and only works for behavioral health providers. The RCM service covers verification of benefits, utilization review, billing and collections, patient responsibility, and denials and appeals, including level of care denials. Behave Health's EHR is designed to document the medical necessity that payers like Anthem demand, so the level of care billed is supported. Behave Health is not a healthcare generalist. The team works only for behavioral health providers and has working relationships with every major insurer. Stop absorbing Anthem's level of care denials. Book a 20-minute demo of behavioral health RCM and medical necessity documentation at behavehealth.com. See the RCM service and EHR designed to document medical necessity and appeal level of care denials at behavehealth.com.